Hey guys, welcome back to the Dynamic Body Project. I'm Dr. Swearingen. Today we're talking hips, specifically connective tissue of the hips. Now, connective tissue can be really any tissue in and around the hip area. We're talking joint capsule, ligaments, tendons, anything that is connecting bone to bone or muscle to bone. We're wanting to target that today. Why are we targeting this? Well, we've been treating a lot of muscle-related injuries and pain in our previous videos. Now we're wanting to address proper range of motion, allowing that joint to move like it should so we can, again, gain more lengthening of that muscle, we can gain more recruitment of those muscle fibers, and limit the risk of injury as we move forward with our athletic activities. So the very first exercise we're going to start with today is going to be called a 90-90. This is very popular today. You can find it all over the internet. We're going to address what we're hitting, why we're doing that, and then how to activate under tension. So let's jump right into it. To start this, we want to make a right angle with our left leg. My left shin is going to be facing you, and so now I'm going to want to create another right angle on the back leg, my right leg. My thigh is now facing you. Now, our foot, a lot of people get comfortable because they'll tuck it in or they'll tuck it in. Make sure we have those steep angles so we can really stress the joint capsules of the hip. If you get pinching in the knee, in the ankle, in the hip, this is not the time to force it. We're going to want to relax into this. We're going to take our left hand for our left leg and create a firm base. Try and square up those shoulders. Now, there will be a point in time I talk about activating under tension. This is not one of those. What I want you to focus on most important here is rotating your pelvis forward, like I'm trying to make a big C in my back. We should feel this on our butt on the left leg, where that hamstring's inserting into the ischial tuberosity of our pelvis, but we're going to call that the posterior capsule. So as we go down, we want to be almost in a cobra pose with our upper body. We want our chest reaching up and away, and I'm only hinging at the hips. I'm going to drive down. Again, firm side, don't collapse here. Keep that strong. We're going to keep reaching that belly button forward, and we're going to hold this between 1 to 2 minutes. I prefer to hold this for the full 2 minutes. Say we're done with the 2 minutes now. We're going to hold this position, and we're going to now stretch the back capsule. We're going to take our left hand and we're going to grab our right hip. Now, you see I do have a bit of a sideward C here. I'm wanting to try and straighten that spine up, rotate my shoulders towards this knee, and hang out. We can grab the back shin if we need to. Again, chest nice and proud, and hang out. If this is too much for you, we can again post with the back side and work on getting that chest into a good position. We're going to hold this for 60 seconds up to 2 minutes. Again, I prefer the 2 minutes. You're going to feel this really big through this anterior capsule area now. So if we start and we hit this side, we have to rotate to the other side of the body. For today, all we're going to do is just do a standard switch. We will modify this to a different move in later videos. Again, right leg is going to be shin towards the camera, square. We're going to kick the left leg back, and we want the left shin to be square too, creating 90. I post with the right hand, nice and proud, and I'm going to try and cobra pose. I'm rolling my pelvis forward and keeping my chest up. We're going to hold this 60 seconds to 2 minutes. Once we come out of that, we're going to grab with the right hand on the left hip. We can stabilize with the left hand in the back. Chest up, try and square the shoulders away, and I'm leaning that way. Again, cobra posing towards the left now. If this is too much, we're going to sit here and post with our arm, trying to rotate away. 60 seconds to 2 minutes. We're putting a lot of time into these joint capsules, folks. We want to get that stimulation and allow our body to say, okay, we can release the guarding and sink into it. Take your time. If it hurts, again, this is not the time to force it. The next exercise we're going to do is what I call an M stretch. It's not something you see every day, but as soon as you get into it, you're going to be like, holy smokes, this is a lot bigger stretch than I thought. So what we're going to do, we're going to lay on our back. have our legs and we're going to spread them. And we want to create an M with our legs. Now in this position, I want to try and let my knees touch. Now I had my head up talking to the camera, but we always rest the head on the ground. And I just want to let this sink in. I'm not forcing my knees down, I'm just letting gravity work. And we're going to hold this. If you're very flexible and your knees are touching, just walk your feet wider to increase that stretch. You're really going to feel it along the IT bands. You're really going to feel it along the lateral hips. You're really going to feel it through your TFLs and that anterior capsule. Again, we're just going to hold this 60 seconds to 2 minutes. Once we're done with that, the final stretch of the day is a supine butterfly. Really nice exercise. What we're going to do is we're going to bring our knees up and we're going to grab our shins with our hands. And we're just going to allow the weight of our arms to pull those legs down. We do want to try and pull our knees more towards our face. And we're just going to hang out in this position. A good side view. And we just let gravity work. Again, we're going to hold this 60 seconds to 2 minutes. Guys, these are really good stretches to start working and hit the joint capsules. Structures we just haven't really talked a lot about yet. In later videos, we're going to start talking about putting stimulus into these structures to teach them how to be ready for increased forces. Until next time, guys, like, share, save our videos, leave comments at the bottom of the page. I'll talk to you soon. Have a good day.